You're listening to the Sisterhood of Limitless Living podcast. I'm your host, Dr. April Moreno. I'm a public health specialist focused on integrative wellness and autoimmune living, supporting the community of women, where I help you to live your best quality of life through being your best self-advocate. Let's get started. Hello, Sisterhood. Welcome to episode number 56 of the Sisterhood of Limitless Living podcast. Happy spring. We're well into the spring season at the moment here in the Northern Hemisphere. And it's beautiful, the flowers, and it's really starting to warm up outside. This is going to be our last episode of the month of April this year, 2020, as we navigate pandemic season here, this era of COVID-19, and also in the podcast world here with the Sisterhood, we've been focused on rebirth and renewal as the topic. And so we could not continue this month without referring to the life of women and also referring to women's health from an autoimmune perspective. She is a conscious women's health and wellness educator. Her name is Lilia Gomez Ashe. To give our respect and appreciation to mothers and women's health out there, today we are talking about women's autoimmune health and how we can cultivate a conscious perspective of women's health. We'll be talking about these conditions as they relate to PCOS and endometriosis and having a healthy perspective of your body and reducing stigma, reducing shame, and being able to connect with all of who you are as a human being, as a woman. I'm looking forward to talking to Lilia and sharing this with you, this episode on what I'm calling cultivating a conscious perspective of women's autoimmune health. Before we begin, I just wanted to let you know that we are heading toward our 1-year anniversary. I was really hoping to have an event in person in Los Angeles to celebrate the 1-year party, 1-year anniversary of the Sisterhood of Limitless Living. But now I'm going to think about how I can be more creative in the month of May to bring about an online celebration of some kind for the podcast. So stay tuned for that. Likewise, if you are a professional who has a service or a product that is suitable to the autoimmune women's community, if you're looking to sponsor the podcast in any way, reach out and email me. You can message me on Instagram at Dr. April Wellness or message me on Twitter at SL3Limitless, and let's talk about how we can support each other in serving the autoimmune women's community. So again, to celebrate this last week of April, to continue on the theme of rebirth and renewal, today we're talking about autoimmune women's health. I hope you enjoy the episode. Hello, Sisterhood. Welcome to another episode of the Sisterhood of Limitless Living podcast. Today, we're going to be talking about the topic of women's health, especially as it relates to the autoimmune journey. So this is a topic I'm really excited to talk about in more depth. As you know, we've talked about PCOS in the past. We've talked a little bit about endometriosis. Today, we're going to get into a little bit more detail on the subject of women's health and how to get mindfully and holistically and even medically connected to your health and wellness. We're going to be speaking to Lilia Gomez Ashe today. She is a conscious women's health and wellness educator. Lilia, welcome to our podcast.
Hi, everyone. Thank you so much for having me as a guest. I'm really glad to be here.
Thank you so much. Could you tell us a little bit more about you?
My name is Lilia. I've been in the healthcare field for over 10 plus years. And most recently, I actually started on a journey about women's health and wellness and being able to empower women to really getting to know about their health on a conscious level, especially when it comes to women's health in the areas of reproductive health, fertility, and breast health.
In terms of conscious health and wellness, what can you tell us?
So when it comes to our consciousness, it varies depending on the individual's lifestyle. The best example would be the most current recent project that I've been working on about the womb area. A lot of times we aren't consciously aware of how we're connected with our wombs. That actually incorporates throughout the whole woman's health in our journey. And what I do is mindful practice to connect women and individuals to get that self-healing practice of full love in that space, to be able to release any stagnation or creating an energy relationship within the womb area, which is also known as the pelvic area. So consciousness is more about creating awareness within your own inner conscious and bringing that to life. So that way, when you are on your healthcare journey, you're able to walk more in a place of harmony instead of feeling stressed and distressed in regards to what may be happening around your health or your lifestyle.
Yeah, that makes a lot of sense. And it's really interesting that you mentioned about a lot of the energy and a lot of the stress in the pelvic area, because I've been learning yoga lately. I'm doing teacher training, and they keep talking about this and nobody's getting into much detail on this. I wonder if you can comment on this a little bit, where when we're doing a lot of stretching, like restorative yoga, we're doing a lot of hip releasing exercises, and they talk about how much emotion comes out when we're in these positions. And I know for myself as well, I took a yoga class where we were doing like this hip release stretch for a couple minutes. And then at the end of the class, I was crying. I'm really curious to know if you have any opinions or any views on what's going on.
Absolutely. So a lot of times when it comes to the pelvic flooring area, when we have any stretch and movement in the area, it all correlates to how we were raised when we were children and young girls. So if we didn't have the inner conscious of how to address our reproductive health or our sexual health, then it comes back later in life where we might have experienced some trauma, or maybe have witnessed some things, or maybe we're just carrying a lot of the emotional feelings and energy in the womb pelvic area. So in our wombs are really a place of sacredness. And for women, when we're not outspoken or we kind of just hold things, we tend to suppress those emotions right up to the belly button in the womb area between the pubic bone and the belly area, which is known as your sacred space for the pelvic region. Anytime we have a movement or we participate in an exercise that allows circulation and movement to start flowing, we're able to release any negative stagnant energy that we've been holding on to. And that can actually trace back to any possible past references in your life, in your upbringing, or relationships, or any trauma. So sometimes it spikes a little bit of that healing modality and you're releasing. So if you are able to cry along that journey, it's your body telling you it's ready to release little by little on small increments to be able to heal yourself from within, so you're not carrying that emotional baggage right in the pelvic region. And also we're allowing circulation for blood flow. So for example, like if we are the 9-to-5 worker, because usually I am too, if we're sitting down all the time and we're not moving the body, and like you just mentioned, you're participating in these classes where you're allowing your body to move slowly and freely, you're allowing for the circulation of the oxygen and the blood circulation to also flow freely in the reproductive area. Because a lot of times if we're sitting down for 8 hours, there's not a lot of mobility going on there. And then when we're able to allow mobility, we're able to break up that stagnation we may be feeling internally, and that can come also emotionally.
That's a great explanation of what's happening. Thank you.
Yes, absolutely.
Can you tell us about the PCOS and endometriosis experience, for example? You mentioned that you have worked with some women who have had these symptoms or these diagnoses in the past. What sorts of experiences have you seen?
Some of the things that I have experienced, and this was probably in the days when I was working as a women's case manager, I believe this was about 2 years ago. A lot of the women were actually coming to the GYN clinic. It's when I would rotate to GYN clinic at times. And these were where the conversations would actually take after the patient was seen with the provider. They felt more comfortable on someone who can relate or have that commonality of understanding, because sometimes it's a little hard to be expressive with the medical provider with everything that's going on, and we just tend to shy away from what's really going on. So some of the things that women have expressed when it comes down to PCOS is the weight gain, unexplainable weight gain. They just don't understand why all of a sudden the weight gain that they're gaining, and they're not sure why. Sometimes they try to trace it back to how they're eating or if there's stress involved. A lot of times it's also cultural too. When it comes to the weight gain, is how are we eating with our culture food? Is it healthy food or is it comfort food? Most of the time it's comfort food. And so the weight gain kind of applies a little bit more quicker. But some of the symptoms that some women do experience is the weight gain, first and foremost. Feeling fatigue is another one. Women describe it as, I don't have enough energy. I feel tired all the time. I feel like I haven't slept a full 8 hours, or maybe I'm just sleeping 4 hours out of the 8 hours. So a lot of fatigue in the body. They finish the day, they feel fatigued. So there's really no REM for the body to catch up on their resting. So they're constantly feeling fatigue. And along with fatigue, they're also noticing that there's unwanted hair growth in certain parts of their body. And for some women, it could be in the chin level where there's unwanted hair, or maybe an increase in hair growth underneath the armpit or other parts of the body, as well as possible acne breakouts. What we also call often at times adult acne is happening, because with the polycystic ovarian syndrome is that the hormones are shifting, and when the hormones shift, mood changes start happening, and so that causes for the body to stress, obviously push for the levels to be a little bit off, which can cause stress, causes acne, and if we're not eating healthy, then we're having weight gain, and if we're not exercising, then fatigue kicks in. It's like a little trickling effect, and if our moods are changing, this can also be potential signs PCOS can contribute to anxiety. So often at times we really don't know how severe the symptoms are until the woman actually starts to ask questions or goes to the medical provider until it's already like a little bit more severe. So a lot of times we try to tell women and educate women to say, get to know your body, so that way the more familiar you become, the more you can have that dialogue with your medical provider to see what recommendations or plan of care you can do, whether it's Western or holistic, or if your provider supports holistic route, because those are conversations that need to take place. And then as far as endometriosis, that's a separate condition that does exist. Those symptoms can vary depending on the woman's health. Just like PCOS, your symptoms can vary. Although we're women, we're all common, but we all have different symptoms, and we all experience symptoms in a different manner and in a different way. For endometriosis, you can have really painful menstruation periods. And this can be as early on as your teenage years. And people just often just, oh, you just have really bad cramping. And then maybe until you get into your 30s or 40s, maybe it got diagnosed into endometriosis. And it takes a while for endometriosis to be diagnosed, because there really is no particular screening at the forefront of your first visit saying I have really heavy menstruation. There's like really no particular screening, and we can say, I want to take the screening to see if I have endometriosis or not. A lot of times endometriosis can start in the pelvic area, but it can also spread to other parts of the body. So some common symptoms with endometriosis would be painful sex. What I hear is one of the most common ones, as well as infertility, as well as experiencing a lot of bloating in the abdominal area, as well as constipation, maybe not always having a good flow of bowel movement. So those are some pretty common ones. And constant chronic pain in the pelvic area along the lower back. So you mentioned like movement. Movement helps to also break up any painful symptoms for endometriosis and PCOS, because we're allowing movement in the flow of the pelvic region.
Holistically, what are some ways that are available to help women with these conditions?
Holistic is a beautiful word, because when I think about holistic, I always tell the individual, holistic is at the forefront of prevention. Sometimes women don't even get diagnosed with PCOS or endometriosis until later on. But if you have a presentable symptom, some of the things that you can do on a holistic route is take a look at how you're eating. Are you eating nutritional food, or are you eating more of a comfort food? Are you exercising? Are you creating movement for your body so it breaks up any stagnation that might be happening in the reproductive area? You can also see an herbalist. That's to see how comfortable you are, to see if you're wanting to go the holistic route. You can also do other exercise movements like pelvic flooring to kind of help alleviate some of the painful symptoms that you might be having. But you also have the Western, right, where you get to see the medical provider and refer you out to a gynecologist. And so you have access to the best of both worlds, Western and holistic. It all depends on the individual, what their preference is to their health journey. Sometimes some doctors might not agree with the holistic route, or sometimes doctors will be like, yeah, whatever helps alleviate any of your symptoms or treat any of your symptoms. But once again, it will vary depending on the woman's health and condition and how far in advance is their PCOS or endometriosis. But there are ways to actually try to alleviate some symptoms in the holistic route. I had mentioned one of them was seeing a herbalist. And herbal is being able to do treatment in the pelvic region with herbs from the earth. We have all these beautiful herbs and plants that have nutrition and comfort for alleviating symptoms. Sometimes you may want to see, if you want to look into an herbalist, find out who is certified local herbalist that can help women in that area in women's health who have those conditions. And or like I said before, if you're really more on the Western side of things, you can follow up with your medical provider, really have a dialogue and a conversation that takes place. Obviously, you're not going to get 30 minutes to have a 30-minute conversation, but being prepared of which questions you want to ask for the provider. And then if the provider agrees with you, having you get referred to a gynecologist, see a specialist, and see what the plan of care would be. Some of the follow-ups in regards to being able to follow up with a gynecologist, they'll do screening questions for you to see where you're at with the symptoms and the pain. But like I mentioned before, there are lifestyle things that you can do. One was nutrition, one is exercise. If you wanted to see an herbal medicine provider, you can. Nutrition plays a big factor to what contributes to our reproductive health. So it's really important to be aware of how are you consuming your food, because that also plays a big role in our reproductive health. So there are a couple of things that you can do. One of the things that women can start doing is empowering themselves to educate themselves. Obviously, don't go Googling, because I feel like Googling portrays a lot of the fear, like, oh my God, I'm going to have this and I have to get on it. It's more like find out what it is that you're experiencing and don't jump into the conclusion into seeing until you get diagnosed. And like I said before, sometimes being diagnosed can take a lifetime depending on the individual's health background and their needs and their symptoms.
And then if you do get diagnosed, it could be a misdiagnosis. So there's no guarantees when it comes to these diagnoses.
Absolutely. And that's a good point to bring up. Sometimes we're diagnosed and then we're questioning, is that really my diagnosis? And I think those are important dialogues to have with your medical provider to make sure that you feel comfortable with the diagnosis and having those conversations with the medical provider.
We're both in the public health space. You also work in the field of public health?
Right now I work in the nonprofit sector, which I really love, but always in the health area. I've been working in the healthcare for 10 plus years now. Oh my gosh, it's been a long time, but I'm very passionate about it. And I think the more I talk to women just like you in creating dialogue, I appreciate those conversations because we learn so much from one another.
I would love to hear a little bit more about the communities that you serve.
Depending on the program for the nonprofit, it just depends on the type of population and then the type of service. In reality, we really try to serve all people, but sometimes people of color are higher prone for certain conditions to exist. If we can be at the forefront for screening and prevention and education, then that lowers the risk for certain populations to not be diagnosed at a later stage. But that also takes time because only 1% gets allocated to prevention. So a lot of times when we see patients, they're already diagnosed. I'll put, for example, this is not autoimmune, but diabetes. Perhaps at some point in their life, they were pre-borderline, but they weren't adjusting their lifestyle until they got into onset diabetes. And now they have to be treated, and now they have to make sure that they take the recommendations and lifestyle changes. So if we can jump in the forefront of things to avoid getting diabetes, for example, it can be done. Can we prevent endometriosis and PCOS? Sometimes, maybe perhaps there is a chance if we live a healthy lifestyle, but at the same time for women, it's also we're women and we have hormones in our bodies because in our transitions of our wellness, our body's going to continue to change. So it's not going to be staying stable throughout the whole lifetime. There will be pre-existing conditions, and if we know about pre-existing conditions, then we need to know our narrative for our health. Like, what do we need to do as far as initiative to make sure that perhaps PCOS doesn't get more severe than what it is?
Are you seeing health trends in terms of women of color when it comes to conditions, women's health conditions? What are you seeing in terms of what's happening?
Women of color get diagnosed at a higher rate for reproductive health issues. And I think part of the reason is because we're the highest that is actually on birth control options. And so if a woman can find out if they're going to take a birth control, preconception or pill or pneumocin, whatever it may be as far as the option, they kind of need to know what is the long-term effect. Now, I remember my mother told me this a while ago because in the era when we have proactive women working in the work field who are go-getters and, we want to make sure we can meet our goals. And so at some point in our lifetime, we were taught, like, if we can get on a birth control pill, then we're taking initiative of our health. But no one ever really talked about what is the long-term consequence if we do get on this birth control pill or whatever the option is that's suitable for the individual. No one ever really talks about the long-term consequence. And so what I do see is a trend of if a woman utilized birth control pill, maybe from her stages of like early 18 to early mid-20s or maybe early 30s, then they start to see a transition in their health later. And they'll see a drop in like painful menstruations or they're breaking out. And so when they're on this journey of birth control pill and then the aftermath is that we don't know as of yet if options could contribute to higher risk for PCOS, endometriosis, and all of that. But because we are women of color, we just get higher risk for being placed on these medications, and we don't know the long-term effect that it has in our reproductive health. And so if we're seeing this trend, and what I see is this trend happening is that, I'll put, for example, a woman who chooses to have an IUD probably gets on the IUD for maybe 2 or 3 years and then starts to notice that she has more than one bleed or spots, but she decides to just continue and disregard the symptoms then that can cause women to have reproductive health issues later in her 30s and 40s and 50s, may even be causing to enter premenopause at an earlier stage or later stage, depending on the individual's health. But that is one of the things that I see a lot. Women of color have a lot of reproductive health issues. I'm not going to say it contributes to solely just to birth control options, but we have to consider our lifestyle and our culture and how we're having access to resources and being able to be connected. So highest rates that I do see is infertility, miscarriage. I do see prolapsed uterus a lot when I used to work in a GYN clinic with the medical providers. A lot of women also suffer from very, very heavy menstruation. Women do suffer like severe menstruation. They can bleed out 3 days, heavy flow. I think we need to be more cautiously aware of being able to have those dialogues to see, is this a suitable option for me? And do I know if this is going to affect my reproductive health or not? And often at times, there's not enough education behind it. Often at times it's made as a quick decision to get on it and then deal with the consequences later. But then the consequences can be more severe than expected. So it just all depends on the individual's health history, which is really important.
I love the fact that you mentioned earlier about nutrition, about healthy food and comfort food. It's very rich. It's not suited for like everyday consumption.
In different households, we all have that beautiful comfort food that comes with culture, upbringing. When we see these beautiful dishes, we enjoy it, we consume it with love. But often at times too, we don't know if we're tolerating certain dishes. So it tastes good. Maybe within the same day or a day later, we notice that our digestive is a little messed up. Maybe we had a breakout of like a rash or acne. So a lot of times we're not sure if we're able to tolerate the comfort food because it comes from such a good place, but we don't know if it's also contributing to health risk factors that can contribute to potential health effects. So always try to figure out a balance. Like I talk to women and some women notice like, yeah, I had to cut out dairy because I didn't realize how much it was affecting my digestion and it was contributing to me having rashes. So a lot of times we're unaware because in the household we were taught to just consume that comfort. It was a routine. It was regular to see those meals. So it wasn't addressed like it was a health crisis or anything like that until later down the road if you start having some presentable symptoms in regards to your nutritional intake. And the thing is because it's cooked so good, it could be certain ingredients. It could be lard versus vegetable oil. It can be depending like how the animal was butchered, or raised. There's just so many factors that contribute to that. It's just, where do you start? Yeah. The good thing about culture food, it is delicious, but we also have to consciously be aware, can it actually help get me to a health condition? And that's one of the things we have to consider is like health conditions are existing more and more and more because what we're surrounded by, fast food, quick food, processed food, which most community members think it's food, it's access to food, but it's not nutritional food. It's not feeding the right vitamins and minerals that we need for optimum health.
What advice would you give somebody who's just like going through some strange health issues related to women's health, these parts of our bodies that we don't feel comfortable talking about? In many cases, there's a lot of shame, there's a lot of stigma. Maybe they're afraid to go and talk about it or go to the doctor. What kinds of advice would you give someone they don't know what's going on and they're scared?
I just want to say first and foremost, this is not medical advice, but it's more being able to consciously have the dialogue to create education and awareness on a conscious level. So I think one of the most important things, if a woman's going through something and she's kind of unsure, and I'm going to say, for example, in particular to the vaginal area, for example, sometimes women are too shy to talk about a presentable symptom that they felt or if they saw or that they're experiencing because often at times we just don't know how to address it, and also because we find the vaginal area to be a very private, intimate part. And so one of the things I consciously tell women is be more familiar with your reproductive anatomy. Get comfortable to seeing what feels normal and what doesn't feel normal. And then one of the things that you can do is buy your journal and start writing down, like, if there are presentable symptoms, find how long is it lasting, if it's a couple days, a couple weeks, months. Are there presentable symptoms like pain? Are you eating well? Is it pain every day or a couple times? Because the more you know about whatever is happening with your body, the more prepared you're going to feel to either take initiative to make an appointment, to not wait till it's too late, or sometimes for some women, it varies on their environment too, because, there's work, family, and everything else. And to make the appointment in a window of time frame that is not too late. If we're able to journal our experiences when it comes to our physical health and our body wellness, in particular to the vaginal area, is get a journal and start writing down, like, how do you view and how do you feel your vaginal area? Do you feel normal? Do you feel guilt? Do you feel shame? What is going on in that area? Is there any lumps, any pain that it keeps persisting? And then what are some questions you would like to ask a provider if you were to go and make a medical appointment? And so you write down, I always tell people to try to write down at least 3 to 5 questions, because at least out of the 5 questions, maybe 3 questions can get answered thoroughly because there's such a short window of time frame with a medical provider. Mm-hmm. But the more comfortable you can get to know your body and having that relationship with yourself, with your body, and making sure that I'm not going to wait until it gets really worse. It's like becoming more familiar every time with certain body parts. It's going to get you more comfortable to having the dialogues with your medical provider, and making sure that you're coming from a place of consciousness, awareness, and not like a patient that's demanding, I demand, because the provider also too is learning as you go too. Like, they're there to treat, but they're also trying to identify, like, what plan of care are we trying to identify to make sure we can have an appropriate diagnosis. And like I said before, sometimes with PCOS and endometriosis, it could take a while to get diagnosed depending on the woman's health and their lifestyle.
Great advice, very useful information, and very practical information that somebody actually take action on and to be their own best advocate. So I appreciate that. How can people get in touch with you if they have any more questions when it comes to reproductive health or women's health related questions that they may have?
So if anyone has any particular questions, or they're just kind of not sure how to navigate for resources, they can either contact me by email. You can email me at saludablelatina@gmail.com, or you can try to shoot me a DM. I try to be available as much as I can in a gracious window of time frame, because I also have to be mindful of my time and my work and my health. But I usually try to make sure that if I'm able to answer, to make sure that I can empower the individual on a conscious level. So they can email me or send me a DM if they wanted to know more or find out how to navigate a resource, and I'll be more than happy to see if I'm able to do that for them.
Thank you so much. Are you available on social media?
Yes, absolutely. So on Instagram, you can find me at saludable_Latina. I'm usually there just posting positive affirmations, awareness, always trying to promote that healthy, conscious relationship with women's health. You can send me a DM, you can follow me there, or if you really just wanted to shoot me an email or just, again, slide a DM there, and I will try to do my best to answer. They can also find me on SoundCloud, because I do podcasts as well, getting ready for a new season. So they can find me on SoundCloud, Spotify, and I'll be sharing more of that as soon as the new releases start coming out. It's called Saludable Latina, Women's Health and Wellness.
Thank you so much, Lilia, for being here today and talking to us about women's health. I really appreciate it.
Absolutely. Thank you so much for having me as a guest, and I hope we created awareness together. Thank you so much.
Thank you for listening to this episode of the Sisterhood of Limitless Living podcast, Season 2. Hope you enjoyed the episode. Look forward to having you join us in upcoming episodes as well, where we continue to talk about integrative wellness and autoimmune living our best lives, being our own best advocates. Feel free to subscribe on iTunes to the podcast, and we are also available on several other locations as well. For more information about Dr. April Moreno, you can visit aprilmorenophd.com. Take care.